Let's again review the various types of bleeding which we can have in hemophilics. And bleeding is generally deep bleeding, so there is acute hemarthrosis. This can be spontaneous if we have a severe disease, and this can also be secondary to a trauma or a fall or a road traffic accident. Along with that, if this acute hemarthrosis progresses for a long time and there are repeated episodes of bleeding into the joint, then this can transform into something which we call a chronic hemophilic arthropathy, in which there is a problem with the joint space. The joints, as you can see in this picture, there is joint space narrowing. As this is the normal person, and this is the chronic hemophilic arthropathy showing here with the reduced joint space, inflammation in the joint space. There are certain types of osteophytes, the bone spurs. So you can say that this is an early onset degeneration of the joint, and this can present very similarly to a patient with osteoarthritis. And this happens whenever there is a chronic joint bleeding or repeated episodes of hemarthrosis. Similarly, there can be bleeding into the muscles, leading to the hematoma formation, just as you can see here, a classic hematoma presenting here with the swelling of the leg as well. Along with that, certain other presentations are the hemophilic pseudotumor. This is a term generally used when there is repeated bleeding into the joint space. It can lead to swelling of the surrounding tissue. So that surrounding space generally gives us an indication or looks just like a tumor swelling. So that is why it is termed as a pseudotumor, because it's not a tumor, it looks like just a tumor. That is termed as hemophilic pseudotumor. These are certain rare presentations. The common presentations are hematuria. This is a very common presenting complaint. A patient, even with a mild disease, can present with hematuria as well. This can be gross hematuria, this can be macroscopic hematuria as well. GI bleeds can be there. This can lead to various types of variceal injuries as well. Along with that, intracranial bleeding. These are the feared complications. This happens generally whenever there is a severe problem, severe factor deficiency. And this intracranial bleed can have a lot of presentations, as we talked about in the clinical features part, with signs and symptoms ranging from minor headaches to even somnolence or death of brainstem herniation.